Okay. Well, good. Well, hello, everybody. Welcome to the Healthy Joints Healthy Lifestyle Show. For those who don't know me, my name is Dr. Arinola Dada, and I help people with joint pain become pain-free and people with autoimmune disease get their immune system back on track. So today I have an amazing Dr. Deepa Gali, who's a rheumatologist at Overlake Arthritis and Osteoporosis Center. And today we're going to mix things up. So today, Dr. Gali is actually going to be asking me the questions, and these are the questions that we're getting from our patients, whether they're inpatients or patients who are on our Gout group on Facebook. So for those who don't know, if you or anybody you know is dealing with gout, please log on to sign up for to be part of our Gout group, which is very supportive. We have physicians, nurse practitioners who will answer the most pressing questions that our people with gout are dealing with. So our job is to give you the tools to be successful because you are already doing an amazing job yourself. You just need some tools to be successful. So we are going to get straight at it. Dr. Deepa Gali is going to be asking the questions. Dr. Gali.
Hi there. Good morning, everybody. We have our gout expert, Dr. Dada, here, is going to answer some of the complicated questions that were asked by our patients. So stay tuned, and we're going to present this today now. Okay, Dr. Dada,
Fantastic.
here is one of the questions from our patient. I have developed toe in my great toe, and both thumbs have a constant ache. I cannot grip a bottle to open due to small bumps that are seen at the base of my thumb. I'm a nurse and cannot take blood pressure medications anymore. I made the big mistake of stopping allopurinol 3 years ago as I was getting rash on the medication. I thought I could manage it with lifestyle and diet, but now I'm regretting that decision. My question is, if I start the gout medications again, will the bumps go away so I can use my hands again? What do you think, Dr. Dada?
You know, so this is somebody who is really trying to get healthy, right? She was given a medication to treat gout, but developed an allergic reaction. So if we start from that question, which is, should I just restart the medication and will they be effective? So the question about whether she should restart the medication is no. So allopurinol can result in a rash, and the more exposure you have, so the more you take it, the more that rash can get worse. And it can actually become a really severe allergic reaction. So we can answer the question about should she restart allopurinol with the answer is a flat no. But she should talk, you should talk to your doctors and say, hey, what are my alternatives? A lot of times your doctor puts you on a medication, right? And if she doesn't hear from you, she thinks all is going well. Your doctor does not know that what happened is you got a rash. And so, because there are other options, right? But I think going back to your doctor and saying, hey, I got a rash with allopurinol, what are my options? She will not be restarting allopurinol, but there are other options. There are Uloric and there are other medications, including the intravenous medication called Krystexxa. So for her, though, for you with your Tophi, so those lumps are basically accumulation of uric acid. As I think everybody on the group knows, the reason why we have gout is our body is not able to clear out this uric acid crystals, and it forms in very severe cases lumps over her toe, like she's saying, and over her hands. And when the gout is this severe, unfortunately, diet is helpful, but it does not 100% take care of the condition. And it's kind of a race against time. So, if you're very careful with diet, you may be able to make an impact. But while the tophi and the lumps are there, they're really damaging the joint. So we really kind of have to move fast. So she's a nurse, she's finding she's having trouble gripping, right? So we need to get control over this gout. So she probably needs to be at least on something to either stop making uric acid or something to clear out the uric acid crystals that she has. So answering the question is, should she go back on lanopionol? The answer is no, flat out no. Should she be on a medication to treat it? The answer is a definite resounding yes. And so So I think she basically needs to go back to her doctor and say, hey, allopurinol didn't work for me. But she does, I agree with the diet and lifestyle changes, because you also have to, you're also doing what you need to do. You know, we talk about shellfish, high fructose corn syrup, alcohol, beer, you know, and avoiding things that are highly packed with protein, shellfish, and, you know, and I think we always said, yeah, and then, you know, even red meat, anything you get from plants is probably fine. The gout is not coming from asparagus, right?
Yes,
Okay. So did we answer every, because like she actually had multiple issues, right? She has
correct.
problems with gripping. So I think that if we can get rid of some of those tophi, we may be able to get some, and she may need some hand therapy, right? To be able
Mhm.
to get that grip back. Did we answer every
Yes.
aspect of that
Yes,
question?
thank you,
Okay.
Dr. Dada. A follow-up question would be,
Yeah.
if they're not taking allopurinol, or if they did develop allergic reaction, we have this alternative medication or another one called febuxostat or Uloric.
Yes. Yeah.
Patients who ask, okay, I took allopurinol, I did react, would I react to another medication? I'm scared to go back to my doctor. So how
Yeah.
do you answer that?
Yeah. So yes, so there are other medications that treat gout. Another medication is febuxostat or Uloric that Dr. Gali mentioned, but they are not related. So there is no cross reactivity. So if you have an allergic reaction to allopurinol, has no relationship with Uloric. And in fact, Uloric does not have that side effect that allopurinol has. So that hypersensitive rash typically tends not to occur with Uloric, even if you've had it with allopurinol.
That's great answer. I hope this clarifies our patient confusion of going on other
Yeah,
medication.
yeah,
All right. So the next question is, I had an operation on my elbow a few days ago to get a bursectomy. When they were surgically opened my elbow bursa, they saw a lot of tophi. However, the elbow has never caused me pain. So my question is, how rare is it to have tophaceous gout without pain? And the other question is, could the tophi have caused nerve damage? Any
yeah.
information would be appreciated.
Yeah. So I'm so sorry this person is dealing with this. But yeah, so the thing about gout is a lot of our people, patients who are dealing with gout, they kind of get the feeling that because they're not having pain, the gout is gone, right? That's almost a universal thought, which is unfortunately not true, right? So gout attacks happen when your white blood cells in your body happen to notice that the uric acid is shifting, right? If there's a change, then your white blood cells, which are your protectors, they're kind of like your body's military. They see the uric acid when it's moving and they go in there because it doesn't belong there and they try to engulf it. And that is what causes a firestorm. But they don't see it every day, right? So sometimes your uric acid is there, your tophi is there, but if your white cells don't see it, then you do not have an attack. Meanwhile, quietly under the cloak of darkness, your uric acid has continued to accumulate. So you may not have pain, right? So you can have, a lot of people have lumps and they think, oh, I made this change. Maybe I started drinking more water and now I'm not having any gout attacks. So they think the gout is gone. No, it may still be quietly accumulating, which is what happened for him. And now he has this lump on his elbow. And so now you have a mass on your elbow that is pressing on the surrounding structures,
Mm.
right? So now the surrounding structures does include nerve. So if the question is, can lumps of tophi cause nerve damage? Well, it can damage anything in the vicinity. So it can damage nerve, it can damage joint, it can damage cartilage, it can even damage tendons and muscles because it's just a mass that doesn't belong there. So just from pressure, it can actually cause some nerve damage. So the unfortunate answer is yes and yes. Yes to the fact that you may not have pain and you just have. I had a patient the other day. I was like, "What's on your elbow?" He's
Mm.
like, "Oh, I didn't notice." He didn't even notice because he's a
Oh,
man. He didn't notice. We women, we notice everything.
everything.
He's like, "What's that?" I was like, "Yeah, what is that?" You know. So he had tophi on his elbow and he didn't know. So it wasn't causing him any pain or any symptoms. You know, I'm sure when he put his elbow down, he's like, "I don't know what that is," but he didn't bother about it, right? So yeah, the two answers are yes and yes. But again, that's why we're here to say, hey, there are some solutions and we want people to be aware of it so they can take action.
That's good. Yeah, all the patients out there with tophi with no pain, go see your rheumatologist now. We
Oh,
can protect and save a joint and a nerve and a
yes.
tendon.
Yes, exactly.
All right. Thank you, Dr. Dada. So the next question is, should I get my tophi removed? It just formed last month. Doesn't hurt, but it's huge on the side. of my toe. So it does create holes when I wear shoes because it's so big, it keeps rubbing. If it's removed, will it come back?
Hmm. Yeah, so there is, so in the world that we live in as rheumatologists that are experts in gout, one of the most exciting things that happened in the last decade
Mm,
is a medication called Cristexa that actually melts away the tophi. So prior to this medication being available, we used to work with the podiatrists and
mm,
the orthopedic surgeons to go and cut out the lumps because we said the presence of these lumps can damage the joints, the
mhm,
nerves, the tendons, ligaments, anything in the vicinity is at risk. So we did that previously, but now that we have the ability to melt away these lumps without causing a surgical incision or risk of infection, then we no longer recommend people having surgery, especially because exactly what he suspected, it can come back,
mhm,
right? If we haven't treated the gout, we just go in there, we take out the mass. Well, what's to prevent the mass from coming back? And usually it's more than one mass,
mhm,
right? There may be small, tiny masses. And Dr. Gali is an expert at kind of ordering this test called a CAT scan. And that's where she's been able to identify people who have multiple tophi. So even if it's not like you can't even see it, you
mhm,
still have this lump under the skin, ligaments, and tendons. And so she's been able to identify people who have these lumps of gout and say, hey, you know what? And we discuss it with the patient and say, hey, look how your scan is showing. So it's not just one lump, right? So we don't want to be having multiple surgeries and heaven forbid amputation, which we've seen,
right.
right? Because this tophi became an ulcer, became infected in the
Mhm.
toe that they actually had to go and surgically take out the toe. So we don't want you doing that anymore.
Thank you. And it's a wonderful intervention of Cristexa in our gout
Yeah.
world. That's it. Yeah.
Yeah, that is one of the most exciting things, honestly, in the world of rheumatology, that
Right.
we have a tool to help people to achieve the things that they want, right?
Right. And without amputation. That's great news.
Without, yeah, yeah. Okay.
I think you kind of answered this question, but I'll just pose it to you. Is surgery the only way to take out a gout tophi, or can it be dissolved by a medication? The
Yeah.
size now is getting a little bit uncomfortable every time I wear shoes.
Yeah, so that's exactly what, so a lot of people are dealing with this, right? And they're trying to find, bigger shoes to wear, and they're concerned that they all that lump may kind of pierce through the skin. And once you pierce through the skin, then that's automatically an infection, right? So
Right.
yeah, so exactly. So we have the medications now, and if you have a rheumatologist, contact your rheumatologist. All rheumatologists know about this option and they will be able to help you. And if you're in the local Seattle area, come to our clinic at Overlake Arthritis and we will help you or at least give you the tools with which you can talk to your doctor and say, hey, there's this medication. It can melt away the tophi to avoid surgery because surgery can sometimes get very complicated.
Mm-hmm.
And we actually work with podiatrists too. A lot of podiatrists refer to us so that we can work hand in hand to make sure that our patients get the best outcome. So, but yes, the answer is yes, there is medication that can help people.
Thank you, Dr. Dada. That's all for today.
Okay. Well, everybody, thank you so much for listening. Thank you, Dr. Gali.
Thank you, Dr.
Really
Dada.
appreciate your time. And so again, if you think this video is helpful, do like it, do share it, do join the Got Gout group on Facebook. And if you have gout or you know anybody that does, share it with them. Come visit us at our clinic at Overlake Arthritis and Osteoporosis Center in Bellevue. Thank you so much, everybody, for listening. See you
Thank
soon.
you. Bye-bye.
Bye, everybody. Bye, Dr. Gali.
Bye.